TMJ Surgery. Everything about TMJ surgery that you need to care about, including which individual suits the conditions for surgery, the types of TMJ surgery, what to expect. The temporomandibular joint, TMJ, is a hinge-like joint located where your jawbone and skull meet. In particular, the TMJ allows your jaw to slide up and down, letting you talk, chew, and do all sorts of things with your mouth. A TMJ disorder causes pain, stiffness, or lack of mobility in your TMJ, keeping you from using your jaw's full range of movement. Surgery can be used to treat a TMJ disorder if more conservative treatments, such as oral splints or mouthguards. They don't help to reduce the severity of your symptoms. For some people, surgery may be necessary to restore full use of their TMJ. Which individual is suitable for TMJ surgery? Your doctor may recommend TMJ surgery when you feel consistent, intense pain or tenderness when you open or close your mouth. Can't open or close your mouth all the way. Have trouble eating or drinking because of jaw pain or immobility. Your pain or immobility gets progressively worse, even with rest or other non-surgical treatments. You have specific structural problems or diseases in your jaw joint, which have been confirmed radiologically with imaging, such as an MRI. Which individual is not suitable for TMJ surgery? Your doctor may advise against TMJ surgery when your TMJ symptoms aren't that severe. For example, you may not need surgery if your jaw makes a clicking or popping sound when you open it. However, there's no pain associated with it. Your symptoms aren't consistent. You may have severe, painful symptoms one day that vanish the next. This may be a result of certain repetitive motions or overuse, such as talking more than usual on a given day, chewing a lot of tough food, or constant gum chewing. They cause fatigue in your TMJ. In this case, your healthcare provider may recommend that you rest your jaw for a few hours or days. You can open and close your jaw all the way, even if you have some pain or tenderness when you open and close your mouth. To greater than your doctor may not recommend surgery because of the risks involved. They may instead suggest medication, physical therapy, or lifestyle changes to reduce symptoms. TMJ Surgical Conditions. It's important to be evaluated by a dentist or oral surgeon who's trained in TMD. They will thoroughly examine your symptomatic history, clinical manifestations, and radiological findings, to greater than to determine if surgery will be beneficial for your symptoms. Surgery is considered a last resort if non-surgical alternatives are unsuccessful. Types of TMJ surgery. Several different types of TMJ surgery are possible, depending on your symptoms or their severity. 1. Arthrocentesis. Arthrocentesis is done by injecting fluid into your joint. The fluid washes out any chemical byproducts of inflammation. At the same time, it can help reduce pressure that causes the joint to be stiff or painful. This can help you regain some of your jaw's range of motion. Moreover, this is a minimally invasive procedure and you can usually go home the same day. The recovery time is short, and the success rate is high. According to a 2012 study, arthrocentesis averages an 80% improvement in symptoms. Arthrocentesis is usually a first-line treatment because it's less invasive. On the other hand, it has a high success rate when compared to some of the other, more complicated procedures. 2. Arthroscopy. Arthroscopy is done by opening a small hole or a few small holes in the skin above the joint. A narrow tube called a cannula is then inserted through the hole and into the joint. Next, your surgeon will insert an arthroscope into the cannula. The arthroscope is a tool with a light and camera that's used to visualize your joint. Once everything is set up, your surgeon can then operate on the joint using tiny surgical tools that are inserted through the cannula. Arthroscopy is less invasive than typical open surgery, so recovery time is faster, usually several days to a week. It also allows your healthcare provider a lot of freedom to do complex procedures on the joint, such as medication injection, joint reshaping, remove scar tissue, pain or swelling relief. 3. Open joint surgery. Open joint surgery consists of opening an incision a few inches long over the joint, so your healthcare provider can operate on the joint itself. Moreover, this type of TMJ surgery is usually reserved for a severe TMJ disorder that involves a lot of tissue or bone growth that stops the joint from moving. fusion of the joint tissue, cartilage, or bone, ankylosis. Inability to reach the joint with arthroscopy. By performing open joint surgery, your surgeon will be able to remove bony growths or excess tissue. In addition, they are also able to repair or reposition the disc if it's out of place or damaged. When your disc is beyond repair, a discectomy may be performed. Then, your surgeon may replace your disc completely with an artificial disc or your own tissue. When the bony structures of the joint are involved, the surgeon may remove some of the diseased bone of the jaw joint or the skull. Open surgery has a longer recovery time than an arthroscopic procedure, but the success rate is still pretty high. A 2013 study found a 71% improvement in pain and a 61% improvement in range of motion. Advice for TMJ surgery. Any symptoms caused by the disease can be both physically and mentally uncomfortable and especially life-threatening. The goal is to solve your problem. So be open and ready to experiment. At the same time, choose your strategy, take action and start enjoying the benefits. Reference: Free solution for TMJ disorders. Link in the description. Or refer to 247naturalhealth.com to all information about chronic disease. In particular, if you know Qigong and its miraculous improvements to health, visit falundafa.org. Thank you. I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.